Hello, everyone. We're just setting up and we'll be starting shortly. Um, Hello, everyone. We're just setting up. We'll be getting things started in a few minutes. If I can request everybody to make sure that everybody is on mute, that will be great. Thank you. Dr. Jamie, Dr. Jamie, Dr. Sachin, Dr. Deep, can I ask you to put your video on? And Nilesh Pai, can I also ask you to put your video on, please? And Bhavani and Nileshbhai, can I ask you to start your videos? Okay, a couple more minutes. Quite a few people are trying to join, so we're just getting them set up, and then we'll make a start. Thank you. Nilesh, please start your video.
Can I start now?
Yeah, start your video. We can hear you, but
you can hear me. Okay.
yeah.
All right. Good afternoon to everybody.
No, sorry, Nilesh, just start your video on a hold fire. I'll tell you when to start.
Oh, okay.
Just a couple more minutes, everyone. We've got quite a lot of people joining, so I'm just setting them up, and then we'll get going. All the panelists, all your videos are fine. I can see you guys, so you'll set to go. So give us a couple more minutes, yeah? All right, welcome panelists. I just want to do a quick audio check. The visuals are fine. So if I can ask one by one for you to just say a quick hello. I just want to do a quick audio check. The visuals are... so Jamie, if you just unmute and say hello.
Hello, can you guys hear me?
Perfect. Yeah, perfect. Sachin?
Hi.
Deep?
Hi, can you hear me?
Yep, perfect. Brownie?
Hello.
Perfect. And Nilesh bhai? Nilesh bhai, okay. Yep, say something now.
Hello, everybody.
Yep, perfect. We can all hear you. All right, just one more minute and then we'll get things started. Okay, well, while we're waiting for a few more people to join, welcome everyone. If you've not attended any Zoom conference and conference calls like this, I just wanted to highlight a couple of things. So most of you at the bottom of your Zoom window, you'll see a few icons. They will have a raise a hand, a Q&A and a chat icon. So what we'll do when we open it up for the Q&A, if I can request you to use the Q&A icon, where you can type in a question that you want the panelists to answer, we can do it that way. And if anybody has any important or urgent question, you can also raise your hand. And if we have time, we can try and get you on the call. But what I would suggest to everyone is please use the Q&A icon at the bottom of your Zoom window to ask any questions during the webinar. And what we'll try and do is we'll try and cover as many questions as we can. But obviously, subject to the time, we will try and do one question per person initially. And if we have time, then we might come back to the same person again. But initially, we'll do one question per person just so that we're covering as many questions as possible. Okay. All right. Let's get things started off. So what we'll do is we'll do a quick Namayantaram first, and then we'll go through a few key housekeeping rules for this webinar, and then we'll start the webinar. So if I can request Pawnee, can you lead us through Namayantaram? And can I request all the other panelists just to keep your mics on mute so there's no noise interference? Pawnee, over to you.
Jayjanendra Pranam. Hello, everyone. Om Namo Ariyantanam. Om Namo Sitanam. Om Namo Ariyanam. Om Namo Vajayanam. Namo Loe Sabasavonam. Eso Pancha Namo Kado. Sava Pava Panasanam. Mangalaram cha savesim Padamam have Mangalam Padamam have Mangalam.
Thank you so much. And can I request Nilesh by now to say a few words on behalf of Oshawa Association of the UK.
Good afternoon, everybody. Welcome on behalf of OA UK. Welcome to everybody on this special coronavirus webinar. Hope you are all well. Before we start the webinar, on behalf of OA UK, I'd like to convey special condolences to all the family members who have lost their loved ones during this coronavirus epidemic. Today, we are fortunate enough to have Dr. Jamie Shah and Dr. Sachin Shah to be with us to talk on this topic. I hope you will all able to take part and iron out all the burning issues you may have regarding this topic. On behalf of OA UK, I thank both these gentlemen for coming forward and spending a valuable time with us today. Also, I'd like to thank Ashish Pai for organizing this webinar at your home comfort. So thank you, Ashish Pai. As you all know, the NHS key workers, doctors, nurses, and other people are working tremendously hard for our nations. To say a special thank you, OA UK, in collaboration with DIPS Food and DNS Accountants, have organized to deliver hot meals and snacks to the various hospitals for the past few weeks. And I'd like to thank all the volunteers who have been taking part in this organizing these meals. So thank you very much. Also, we have set up a team to help elderly and vulnerable people. More details are on our website for these people who needs any help. Last week, we have launched a coronavirus Seva Fund to help to deliver these meals and snacks. So please, please, please come forward, support us, and help us to collect these funds. I hope you will all do and for this worthy and noble cause. The details are on our website for donating the funds. Also, you may wish to send the checks to our center, whatever you wish to do so. So without further ado, I'd like to thank you all for joining us. And also, I'd like to thank Dr. Sachin Shah and Jamie Shah to start this conference and webinar. Before that, I'd like to convey a special message. Stay at home, protect our NHS, and save lives. Thank you for listening. Thank you. On to you, Dr. Jamie Shah and Dr. Sachin Shah.
Okay, thank you, Nilesh Bhai. We're fortunate. Actually, we have 3 doctors today, with Dr. Deep as well. So I'm going to hand over to Boni, who'll facilitate the session and introduce us to our panelists, and then we'll kickstart things off. So, Boni, over to you.
Thank you, Nilesh Bhai, Ashish. Today, we're very grateful for having this session, for arranging this webinar for everybody during this very difficult time. And we are joined today by Dr. Jamie Shah, Dr. Sachin Shah, and Dr. Deep Shah. So just a bit of background for them. So Dr. Jamie Shah is a pediatric, and he works in a central London hospital. And Dr. Sachin Shah is a general practitioner registrar, and he works in Buckinghamshire. And then Dr. Deep Shah is a general practitioner and works in Kenton and Barnet. So today's format is we'll be covering about 5 to 6 topics, and I'll just go through these with you. So we're going to be covering staying at home, access to community services, misinformation, going outside for essentials, coronavirus symptoms, and self-shielding. So I'd like to hand over to Dr. Jamie Shah. Thank you.
Hi everyone, namaste. So I think the most important thing I think I can cover from today, if I can get one message across to everyone, that is as a Jain community, as an Oshwell community, and as a wider community of London, we all need to make sure we're doing the same thing. And it's very important that you all follow the government advice and NHS advice that's currently out there, because it will change on a week-to-week basis. And the main message I want to put across is that as a country, as a community as a whole, we need to be following the same advice and the same hymn sheet. What doesn't work is the system is if we're all following different information. So I think that's the first thing. So I think the first topic I really want to cover, and I think a topic, especially for children, it's been quite difficult, and families with elderly relatives, is the importance of staying at home. So I'll just talk a little bit about staying at home and why it's so important. So the reason it's so important to stay at home is because it reduces the main reason is to reduce the spread of the virus. So the way they measure a spread of a virus is something called R0. And if we were all out in the community, the R0 of coronavirus is 2.6. So that means that it would spread very, very quickly amongst us. And if any of you guys have watched there's a Horizon documentary on BBC on coronavirus, which explains how quickly a virus with a spreading factor of 2.6 will spread. Whilst if all of us are home, this reduces to 0.6. So there's quite a massive reduction, firstly, from staying at home. And there's 3 main things that you can do to really help with staying at home. The first one is having a really good structure. So what I would say is the night before or the day before, plan things that you want to do, plan a hobby, and especially if you have children, try and normalize things as much as possible. Get them up at certain times, do the same kind of activities you would do in school, at home, after home, meals at around the same time, and just really keeping a structure, I think, is the first one. The second thing that's really important is really good exercise. And that my personal recommendation is that you do 20 to 30 minutes of exercise. It doesn't have to be super intense, just enough to get you sweating and to keep you active. And the third recommendation is that during this time, that it's really important that you eat and drink well as well. So make sure you're getting at least your 5 a day. You're getting a wide variety of fruits, minerals, vitamins, and you're drinking well. And then the other things that are quite important are just your mental health as well. So make sure that you're speaking to someone every day, whether that's via Zoom, WhatsApp video calling. Really do take time out to look after your mental health. And the final thing, another thing I think that's quite important when you're, even while you're at home, even if you're not going out, is hygiene. So just the importance of washing your hands properly. I'm sure a lot of you guys have seen the 6 points on YouTube or other websites about 6 points of hand contact. So really make sure when you're washing, you're really getting in between all of your fingers there. You're getting into the nail beds as well here. You're really washing the sides of the thumb and the wrists as well. And you're really doing the palm to palm action. And that all of that is done under running water with soap as well. And I think those are the main things that I wanted to say about kind of staying at home. And just to be aware that if you do have elderly relatives as well, there's a lot of guidance on kind of which elderly relatives are at risk. And there's a lot of resources out there for family members, especially adults who've got elderly relatives or adults who've got young children and who want support. So I think there's, I've posted a post up about children earlier, but there's a lot of resources there for adults with elderly relatives. And there's a lot of resources as well, especially from charities like Mind, about keeping your mental health, doing things like meditation, yoga. And I think that's quite important. I think the second topic that I wanted to discuss, and I think some of my colleagues might be a bit better at that, would be access to community services. So I'll just put you through to Dr. Deep and Dr. Sachin.
Okay, so maybe I can start, I guess. So I'm a GP and I work in Kenton and in Barnet. And I think the first thing to say is that most places will have a slightly different configuration of services. So you'll have to really discuss with your general practitioner into what you can access. I'll just give you a brief outline of what's happening in North London at the moment. So specifically for Harrow, so this is Kenton, the guidance at the moment is that you can contact your GP, and all GP surgeries are doing telephone triage first. So you can get in touch with your GP. Different GP practices will have a different way to get in touch with them. You will get a telephone triage by either a GP or a nurse. And the reason for that is to reduce footfall in the surgery. And again, just to, like Dr. Jamie said, to reduce the spread of the disease, also to protect the staff. So what happens is, whatever your condition is, whatever your problem is, you'll be assessed on the telephone by your general practitioner. And then a decision will be made if you need to be seen. And there's lots of different ways to see you. So some GPs, including myself, are doing video consultations for specific conditions. And then you may go on to need a face-to-face opinion as well. And if that's the case, then this is where the services become a bit more different. So specifically for Harrow, we are bringing patients into the surgery who we think are low risk for coronavirus. So we will ask specific questions to check that you are low risk. And then if that's the case, we'll bring you in. I will also be wearing equipment, so personal protective equipment to protect myself when I examine you. And the idea would be to have that face-to-face interaction as short as possible. Often I tell my patients to go back home and then I'll call them up with my plan, just to reduce that time again and to protect my patients and to protect the staff. So that's one service that's happening in Harrow. The other service in Harrow is what's called the Community Hot Hub. So this one is set up in Rayners Lane, so in Alexandra Avenue. And this is a service for patients who are at high risk of coronavirus. So these are patients who either have coronavirus and the complications or other conditions, and also have possibly coronavirus. So these patients are being seen at the hub in Rayners Lane, the Alexandra Avenue hub. I've done a few shifts there. The system is slightly complicated in how it works, and your GP will refer you there. He'll book the appointment and give you some information on that. Essentially, you have to stay in your car. You get a telephone call from the clinician, who will then assess you on the telephone. They'll bring you in if you need to be seen. Everyone will be gowned up again, and you'll be seen. The idea is, if you've got symptoms of coronavirus and need to go to hospital, then we can send you in. If you can manage in the community, and we're trying to manage as many people as we can in the community to reduce the pressure on the hospital, then that's a possibility as well. In Barnet, it's slightly different. At the moment, the surgery I work in is not seeing anyone face-to-face, and we're directing all patients to a cold hub, which is where patients are seen face-to-face by another GP service. And in Barnet at the moment, everyone who's got suspected coronavirus is going to hospital. I think the most important message is that if you need to see someone, then first speak to your GP if you can. 111 is also available to speak to in terms of resources available, and they're very good. The advice at the moment is to try and reduce your attendance to A&E, but also if you feel you need to go to A&E, then that should be a decision that you should make and go. There's lots of evidence coming out now that patients are not attending A&E for routine reasons, so for heart attacks and strokes. And if you've got any of these conditions, you're worried about it, then the advice is, if you need to go and, you need to use the resources if you do. But this is just a general overview of the resources. I think they might vary across the UK, so it's just bearing that in mind as well.
Okay, I think that's really helpful, and I think the only thing just to add on to that from a kind of children's point of view is there's a lot of guidelines from NHS website on 111 symptom sorter as well. So if you go onto the NHS website, and there's a part where you can kind of go through a worksheet that will tell you what to do based on your symptoms, and I would really recommend that as well, especially if you're unsure of, do I need to bother my GP? Do I need to phone 111? Do I need to go straight to A&E? I think that website's really useful, and I was having a look at it this morning, a trial with it, and it does seem to work really well. I think the third point I wanted to put up and discuss, especially as an Asian community, is misinformation. I think this is a big one that I wanted to discuss, and I think particularly Dr. Sachin Shah has noticed a few issues as well. As Asians, and particularly as Indians, we all have very big WhatsApp groups. We all communicate a lot with our families, which is a great thing, actually. It's great for getting out the right message, sending positive vibes, sending a lot of love and support. However, one of the biggest problems with having these big groups is forwarding messages and forwarding misinformation. And I think one of the biggest things that's being forwarded, and I really noticed it the other day, was a medication called hydroxychloroquine. And I've had tons of messages come to me saying hydroxychloroquine cures corona. It's been proven in this. My relative's friend told me via WhatsApp. So the first thing I want to say is that that is completely untrue. So be very, very aware of any of these advice sheets coming through. And hydroxychloroquine actually in high doses has killed people who are trying to follow these messages. And it's a really, really serious thing that I want to kind of make sure that, more than happy for you guys to forward messages, but please check the information in those messages with the NHS website and the current government guidelines before you forward a message, because actually it could spread misinformation, and that is one thing as a community that we want to we don't want to happen at all. And then second thing I really, really want to keep stressing is, if you want to help, you want to spread information, please spread resources that are already out there. Please spread resources that are on the NHS website, the Royal College of Children's websites, the government website, charities like Mind. These are all really, really good resources. And again, it promotes the message as a community, as a country, we're all singing off the same hymn sheet. And I'd like to just pass you over to Dr. Sachin Shah, who's just got a few mythbusters to kind of discuss a bit further to you guys.
Thank you, Jamie. So I think the importance to reiterate sending this information, we have to check our sources. The source that says on the WhatsApp forward sent from my doctor, my brother, my cousin, who may be a doctor, we don't know this because it's just a written letter on the WhatsApp message. You should be able to check your source and prove these claims. Things that sort of make information sound legitimate or sort of stress on things, or include sort of some information that is true, but also some information that may not be true. So be careful with these things. Other things to be aware of are emotional posts. So if you've got sort of an emotional, someone pleading, someone, you know, all these sort of things, there's going to be an impact, and that emotional factor is going to play on you to help you forward this, especially sort of the voice recordings and video messages sent by people. It's very easy in this day and age to send a recording, a voice note, or a video, and send it to the mass. So just be very, very careful with this. The key things, the key myth busters, I'm just having a look. So the one thing that we talked about was the hydroxychloroquine. Sorry. The other thing is that we've got a sort of DIY face masks. So there's information, especially from the US, talking about how to make your own face mask. Importance of a face mask is good for the healthcare professionals to help reduce transmission or sort of help the rate of infection to them. However, if you who are a patient or a sort of general public who doesn't have the infection, or in fact is having the infection, can actually make you falsely reassured with these face masks, and actually reduce your hand hygiene techniques, reduce the key measures to try protect yourself from it. And also, if you put on a face mask and then touch it, or sort of take it down for a cigarette, for a smoke, whatever you do, that's going to stop the whole point of the face mask. If it gets wet, it doesn't work, especially sort of the surgical face mask. So you've got things that actually don't work, and if not used in the right way, are actually going to increase the risk of transmission. So you don't want that. Things that people talk about are, if I get food delivery or online delivery with a cardboard, you know, the boxes, will I get coronavirus? Well, it's a difficult question because we don't know. There's no evidence that suggests this. You've got lab conditions that say how long a coronavirus lasts for, but we can't translate that to real life. And therefore, sort of basic precautions are fair enough, but we can't give you that information that says, yes, you're going to get it, or no, you can't. Other things that sort of give us, talking about evidence, is whether the 5G masks cause and spread coronavirus. Again, that is incorrect information. And having a high temperature, so going outside in sort of above 25 degrees, that's going to kill the virus. There is no information to suggest that. And these are the important things that we have to be aware of when we're talking about that. And then should we go on to the next things that we should talk about? So when should I go out? So key things to go out is to get essentials. Keep it minimal. We don't need to go out to go shopping for our dhara, our just a little shop for a small necessity. If it's not essential, don't go out for shopping. Stay indoors. Make sure you use your hand sanitizers and your soaps. Wash your hands regularly. Make sure you sort of try keep yourself safe and clean as much as possible. Over to you, Jamie, for the next bit.
Okay, so just wanted to talk a little bit more about going outside. So there is a lot of, one of the questions I think that a lot of people are asking is, when should I use a mask and when shouldn't I? So I think the guidance is, you only need to have a mask if you are taking care of someone with suspected COVID-19. And it's important that you also do wear a mask if you are sneezing, you are coughing. Really important that you clean your hands properly before you put on a mask, and that you know how to put it on properly. And also, when you take off the mask, it's really important that you don't take it off from the front. You take it off from the back, and as soon as you've taken that mask off, you pop the mask straight into a bin, and you also clean and rub your hands again properly with alcohol gel or soap and water. And the other thing as well is, if you are going out to buy resources, groceries, be aware that, again, we shouldn't be doing it, but it does happen, is that people will still go into Tesco. People will still not pick the first milk. They will pick the second or the third behind it because they're still conscious of the date. So anything, when you enter a store or a supermarket, just clean your hands. Most supermarkets have hand gel at the counter. Clean it when you go into the supermarket. Clean it when you come out of the supermarket. And my general advice is you don't need to kind of scrub everything, but just give anything you wash a very quick wipe. Anything you buy, sorry, a very quick wipe with just some Dettol wipes that you can get. Doesn't need to be any specific kind of special antibacterial wipe, but just a general wipe of any kind of plastic or cardboard items that you buy. Then I think the only other thing as well, which we've had some questions on, and that fifth area I wanted to raise was, so what are the symptoms of coronavirus? And I think what I'd like to do as well is, if all the other doctors can unmute and just add any information as I'm going on. So I think the general symptoms of coronavirus really will vary between everyone. They'll vary a lot dependent on person. They'll vary a lot dependent on age as well. So children don't tend to get many symptoms at all. Most children are asymptomatic. That means they have no symptoms. However, it's still very important to be aware that children can still be affected. It does not mean that children are immune. I'm sure you've seen a lot of things in the news that say no children have got it or anything like that. Children can get coronavirus. There's very few cases, but there are still cases of children having symptoms from it. In terms of symptoms, in general, they can range from hardly any symptoms, from just symptoms of a common viral illness, so stomach pain, cough and cold, or diarrhea as well. However, the most common symptoms, so coronavirus generally tends to irritate your upper airways, and that leads to you having the dry cough. And also, as it progresses into the lungs. That can cause a lot of inflammation, which leads to you having fever. And that's also one of the most common symptoms. So I think those are the general symptoms, are kind of fever, high fevers, dry cough. However, other symptoms have been reported as well, such as diarrhea, change in taste, change in smell. And I think those are the general symptoms. And my advice would be that if you have any of those symptoms, to self-isolate. It's impossible to say without a diagnostic test if you've got minor symptoms, if you definitely do or definitely don't have coronavirus. And I think that would be my advice. In terms of when to seek help, I think the doctors from the community would be a lot better at answering that.
Yeah. So I guess the other big sort of symptom that I'm seeing a lot of people present with is shortness of breath. And this is another sign that it's potentially sort of affected someone's lungs. And so the big three, the ones the government is asking people to look out for, are the cough, like you mentioned, temperature. And people have lots of different sort of definitions for a temperature. So it's defined as anything over 37.8 on a thermometer. Otherwise, if you don't have a thermometer, if you feel very hot, very shivery, that's very likely to be a temperature, and the breathlessness. So those are the three big ones that we're seeing patients with in the community. Like you mentioned, Jamie, the thing that decides whether you need to be seen or tested essentially is how unwell you are. So the vast majority of patients are presenting with a mild illness. So if you have a bit of a runny nose, a bit of a sore throat and a cough, and they get better. Some patients are getting more significant cough, fevers, and breathlessness. And these are the patients who need to seek help. The best place to seek help is to speak to 111 first, or speak to your GP. And if you're very breathless, very unwell with it, then in that case, you should be going to the nearest A&E department.
Yep, we don't think I have anything else to add to that.
So I think that covers all of our basics for just a bit of information on coronavirus. Then we'll go to a Q&A. I just want to summarize a bit of everything that we've said. I'll summarize in English first, And then I'll try and summarize in Gujarati, and if Pavni, Ashish can help with that as well, that'd be great. So I think in terms of summary, stay at home. It's really, really important. It massively, massively reduces the spread of the virus. Please, if you get a chance, watch the Horizon coronavirus documentary. There's a really good, just a good scene that shows how well staying at home does. While you're staying at home, really have a structure, exercise well, and do things to look after your mental health, whether that's hobbies, meditation, speak daily to somebody, make sure that children have a good routine, and make sure that you really keep up your hygiene. In terms of access to community services, be aware of 111. Make sure you're following the guidelines on NHS websites and the government websites. Please, please, please do not forward anything that you get on WhatsApp or on Facebook without fact checking it first with our NHS website and government website. That's a really important point. If you're going outside, please ask yourself, do I actually need this or do I want this? Make sure you clean your hands before you leave, before you enter a supermarket, after you've entered a supermarket, and just quickly wipe down anything you buy. Make sure you know if you are going to use a mask, when to use one, and how to actually take one on and take it off. Okay, and finally, just be aware of the symptoms. And if you're unsure if you've got symptoms or not, check the 111 website and self-isolate. Those are my main points. So just to summarize in Gujarati, and again, I can help, my Gujarati is not the best, but ઘરે રહેવો, રોજ દિવસમાં 20 થી 30 મિનિટ એક્સરસાઇઝ કરો, ખાવાનું, 5 થી 7 જુદું જાતનું વેજીટેબલ, ફ્રૂટ્સ ખાવા, હાઇજીન સારી રીતનું રાખો, રોજ હાથ ધોવો, હાથ સાબુથી ધોવાનું, બધી જગ્યા ધોવાનું, એટલે આંગળીની અંદર, નખની અંદર, કાનો, thumbs. તમારું મગજનો હેલ્થ બી સારી રીતનું સાચવો, એટલે ઘણી વેબસાઇટ ત્યાં છે. રોજ દિવસમાં તમારે મેડિટેશન કરો, કોઈ સાથે વાત કરો, ને છોકરા હોય તો છોકરાનું સ્ટ્રક્ચર રાખી મૂકો, એ લોકોનો બી રોજ પ્લાન કરો દિવસમાં, એ લોકોને કહેવો કે તમે શું કરવાના આજે, ને તમને કઈ ખબર નથી તો આપણું કમ્યુનિટી સર્વિસીસ હમણાં સારું છે, હમણાં આપણું ઘણી વેબસાઇટ હોય, આપણે બધાથી NHS વેબસાઇટ ને ગવર્મેન્ટ વેબસાઇટ ફોલો કરવું જોઈએ. એને પર કહેવાય કે તમારો 111 વેબસાઇટ પર કહી જાય ભાઈ તમારા સિમ્પટમ્સ શું છે, તમારે અહીંયા જવું જોઈએ, તમારે GP ને કોન્ટેક્ટ કરવું જોઈએ, કે તમારે ઇમરજન્સી ડિપાર્ટમેન્ટમાં જવું જોઈએ. ત્રીજું કે આપણું મિસઇન્ફોર્મેશન, કોઈ આપણને WhatsApp પર મેસેજ ફોરવર્ડ કરાવીને એ લોકો લખી દીધું કે આ ડોક્ટર ઇન્ડિયામાં આવું બોલ્યો. પહેલા તમે NHS વેબસાઇટ પર ને ગવર્મેન્ટ વેબસાઇટ પર પહેલા ચેક કરો, ને તેનું વેબસાઇટ પર નથી તો આ ઇન્ફોર્મેશન તમે ફોરવર્ડ નહીં કરો. એટલે જ મારી મેઇન પોઈન્ટ કે આ બધું ફોરવર્ડમાં કરવાનું. ઘણી માણસે આ દેશ અમેરિકામાં બી અને ઇન્ડિયામાં બી મરી ગયા હાઇડ્રોક્લોરિક સાથે આ મિસઇન્ફોર્મેશન માટે. ને તો વખત તમે બહાર જવાના હોય તો પહેલા વિચાર કરો આ જરૂરી છે કે મને આ જોઈતું છે. ને તમે જવા પહેલા તમારા હાથ ધોવો સાબુ ને પાણી સાથે. તમે સુપરમાર્કેટમાં અંદર જવા પહેલા આલ્કોહોલ વાઇપ વાપરો. બહાર આવે ત્યારે તમે આલ્કોહોલ જેલ ની તો સાબુનું પાણી વાપરો. તમે ઘર આવે, ઘરમાં તમે તમારું વસ્તુ મૂકી દેવો, બધું ડેટોલ વાઇપ નીકળ્યો એવું વાઇપ કરો, ને પછી તમે તમારા હાથ ધોવો. ને તમે માસ્ક વાપરવાનો હોય ક્યારે વાપરવું જોઈએ, તમારે શરદી હોય કે કોફ હોય ત્યારે વાપરવું જોઈએ. તમે કોઈ વનરેબલ એડલ્ટ સાથે હોય ત્યારે બી વાપરવું જોઈએ. નહીં તો તમે વાપરવાના હોય તો તમે સરખી રીતનું વાપરો. એટલે તમે માસ્ક મૂકવા પહેલા હાથ બરાબર ધોવા સાબુ ને પાણી સાથે. તમે મૂકતા હોય ત્યારે આવું રીતે મૂકે ને પાછળ ઇયર્સનું પાછળ સરખું ફીટ આવવું જોઈએ. ને તમે કાઢ નાખવાના હોય ત્યારે પાછળથી કાઢ નાખો, આગળથી નહીં કાઢ નાખો. ne direct binma muko ne vapidi do pachi hat bhi do એટલે આપણે disposable masks ની માટે વાત કરતા છું ને final point કે આપણો coronavirus symptoms એકદમ બધા varied હોય એકદમ range હોય એટલે અમુક માણસને એકદમ mild હોય એ લોકોનું smell જરાક જાય diarrhea આવો થોડોક cough આવે ને બીજી extreme છે કે એ લોકોનું shortness of breath હોય એકદમ extreme pneumonia આવે એટલે તમારી symptoms હોય તો 111 વેબસાઇટ પર ચેક કરો ને ડોક્ટર દીપ શાહ બી કીધું કે તમને ખબર નથી તો તમે તમારા જીપી ને બી ફોન કરો તો તમે એકદમથી શ્વાસ નહીં લેવાય તો તરત તમે ઇમરજન્સી ડિપાર્ટમેન્ટ બી જાઓ આપણે કહેતા નથી કે તમે માંદા હોય તો ઇમરજન્સી ડિપાર્ટમેન્ટ નહીં જવું જોઈએ આપણે એવું જ કહેતા છે કે તમે માંદા હોય ને રિક્વાયરમેન્ટ હોય તો તમે ત્યાં જવું જોઈએ I think એ બધું so I think we'll open it up to the Q&A session unless Dr. Deep or Dr. Sachin have anything else to add. Or Ashish and Bhavni, anything else at all?
No, thank you so much. We're getting a huge number of questions from a lot of people. So I think let's start going through a few of them. And as we said at the beginning, we will try and do one question per person. And we will try and get through as many as we can, but obviously we might not be able to get through everything today. And we'll obviously send out some links and information after the webinar today. So Pawnee, do you want to start off the Q&As?
Yes, thank you. બધા ઘણું માહિતી આપી છે આજે અને ચાલો question answer શરૂ કરીએ.
So I think the first.
Okay, so પહેલો પ્રશ્ન છે if you are a carrier of the virus, can you infect others after 2 or 3 weeks of social distancing if you may or may not have suffered it?
I can answer that. So if you've got it, it's very difficult to say when you're infective. The guidance at the moment is that from the day you start getting your symptoms, so from the day you develop your cough or your fever or your breathlessness, then you will be probably infective for another 7 days, and that's why you need to self-isolate for 7 days. That's the initial advice at the moment. Some people have said up to 2 weeks. The honest answer is that we don't know how long you will be infected for because it's such a new virus and we don't know enough about it. We think that the amount of infection, the amount of virus you shed and therefore how infective you are reduces with the time. At the moment, the guidance says within a week you will be less infective, and then you can't mix as much. You still have to be socially distant, but you can go back to your normal activities. But if you've been in contact with someone who's got the symptoms, then you need to self-isolate for 2 weeks, because that will be how long you will take to probably get the virus, develop symptoms, and then shed it, and so stop being infective. So at the moment, 1 week if you have from beginning of symptoms, and 2 weeks if you're in contact with someone who's developed symptoms.
Thank you, Dr. Deep. Dr. Jamie, Dr. Sachin, anything else to add?
No, I think that's answered really well. That's exactly what I would have gone with as well.
Great, thank you. I'll move on to the next question. So if in an extended family where you have children and grandparents who are self-shielding but high risk and some are still working, what should they be doing and how do we protect each other?
So I'm quite happy to answer that one. So if you are still having to work and you're an essential worker, I think it's really important that you follow some kind of basic hygiene practices, first of all. So that would include, if you've got a uniform, wearing that, if you can as well, getting changed when you first enter work and when you leave work. Coming home, as soon as you come home, make sure you shower. You go straight into the shower, you change your clothes, and that you wash your hands as well. And if you've got grandparents who who are very high risk, just getting them to wear a mask while you are around as well. And that seems a bit extreme, but if you're working in quite an environment where you are very high risk, you're coming into contact with a lot of the public, that's one thing that you can do as well. And just obviously as well, I think what's really, really important is just explaining to children and grandparents what's going on, and explaining that if you're an adult who is a key worker, that you do have to take these precautions. And the reasons for that as well is sometimes children and grandparents will also remind you to take these steps. So that would be my advice, and that's currently what I've advised my family to do if they're seeing our grandparents as well. Don't know if Deep or Sachin have anything to add.
Don't worry if you don't have a mask. That's not prudent to protecting yourself or protecting the family. The mask is sort of, as long as it's used well, that's fine. If we can't use it well, then let's not worry about the mask too much. Let's worry about, as a healthcare professional or a sort of key worker, how to reduce the risk to the family.
Okay, great, thank you. I'll move on to the next question, and what we'll do is just we'll ask one of the panelists to answer the questions as we go along, so each has a go. The next question is, how long does a virus stay active once in the air? And is there a likelihood of someone will be able to catch it if they, for example, run past that particular patch of air? So Dr. Deep?
So it's a very difficult question to answer because we don't really have the full information for the virus again. This is why we're saying stay away from someone for 2 meters away, because the risk of you inhaling that same virus particle is going to be significantly reduced. There is some evidence at the moment that we think if it's on a hard surface, it might survive for a bit longer, but I'm not going to give you an exact time or exact sort of how long it survives, because it will depend on the conditions. The best thing to do is to make sure you're at least 2 meters away from anyone you don't know, you don't live with your household, because that will reduce the risk of you contracting anything at the moment. And if you touch surfaces, make sure you wash your hands immediately after you touch a surface that you wouldn't normally touch, and that will just reduce the risk of you contracting the virus.
Thank you.
The only thing to add to that is that one of the biggest ways the virus is spread is, like Dr. Deep said, is if you touch a surface, a lot of us then are tempted to touch our face. And that's one of the biggest ways that it's spread, by kind of scratching your nose, scratching your face. So if you're going outside, really do avoid touching your face.
Yeah, thank you so much. The next question is, will steam inhalation and drinking water help? And there's also been another question asking our viewers and attendees to drink water, because according to them, some don't drink enough water. So Dr. Sachin?
So staying well hydrated is very important. Making sure you're eating healthy is important. However, sort of steam inhalation and warm water, there's no current evidence for this. Yeah, so we just have to carry on with what we know. If it helps you feel better, then that's fine, but it doesn't necessarily mean you're going to stop the transmission of it. So that doesn't mean you're at lower risk. So still take the right precautions and still try to do your hand washing and social distancing.
Great, thank you. The next question is about hygiene in terms of visiting the doctors or an NHS environment. Just sort of what happens when you've been seen face to face, and then the cleanliness of the room, and how safe is it to go in a sort of a surgery or something like that. Dr. Jamie?
So I think it's really difficult to answer specifically, because generally, if you come into A&E and you have coronavirus symptoms, you are triaged in a coronavirus area. And everyone from a staff point of view will have masks, will be well covered. And in terms of the area, it is cleaned well. However, to be aware that it's generally very, very low risk if you do come into A&E in terms of cleanliness and stuff, but you will be seen in an area where there have been other coronavirus cases. So I think it's really important that if you do have if you are worried and you are meeting the criteria for accident emergency, that you do still attend. However, if you haven't got symptoms of coronavirus at all, and you've got something that's completely unrelated, or your child has symptoms that are completely unrelated to coronavirus, then you will be seen in an area which is the hospital I'm working in, which is a green area, where there's been no cases of coronavirus or patients with coronavirus symptoms as well. So I think it all depends on what you're attending A&E with.
And if you need to go to A&E for other symptoms that is not coronavirus, if you have chest pain, if you have symptoms of a stroke, anything at all, do attend A&E, because sort of we're not sort of neglecting other cases and not neglecting other patients that need the emergency department as well. So don't be worried about the coronavirus side of things, because your health matters as well, and we're here for you.
Can I just add to that GP surgeries, so patients where we reduce as much as we can the risk of people coming in with coronavirus, but they are cleaned. So attending it's a risk that the GP will make with you. And if your GP suggests that you should come in, then you should also come in, because it's all about a risk-benefit analysis. And if they feel that you will gain something from coming in, that's the only reason they will suggest it. But it's safe to attend if a doctor says it is.
Great, thank you. I'm just going down. This is probably more.
Sorry, just let me jump in a bit. I've noticed that quite a few people want to ask questions. Again, if you're already logged into Zoom, there is a Q&A icon at the bottom. Please type your question in. You don't need to raise your hand constantly. Please type your questions. We will try and come to your questions as much as we can. We're trying to cover as many questions as possible. If you're watching this through the website, again, at the bottom of where you can view it on our website, there is a question sort of form, so you can fill that in and we'll get the question. And again, you only need to submit it once, and we will try and come to it. But there are a lot of questions coming, so please do be patient in case we've not covered your question.
Thank you, Ashish. The next one was more of a statement, but I think we've covered it. It was sort of the symptoms, so sort of the loss of smell and taste, and then just in addition to the cough and fever. So I don't think we need to cover that one again. The next one is, should the general public be wearing face masks while going out for necessities or walks? I think we covered masks as well, but is there anything else that you wanted to add to that?
If you go onto the World Health Organization website, they've got a really good guidance on whether you need to wear a mask or not. And at the moment, their guidelines for the general public, for a healthy member of the general public with no other symptoms, no other conditions, is no, you don't need to wear a face mask if you're going out. But if you are worried, the World Health Organization has really good information on exactly that, when you should be wearing a face mask and if you need to.
Great, thank you. Just conscious that we've also got some questions from our website, so I'll just hand over to Ashish, who'll be able to facilitate that.
Yeah, thank you. Yeah, so we've got quite a few questions on the website. So one of them is from somebody who's saying, I am 70 years old and a teacher. Do I need to worry about going back to work?
Yeah, so I guess I can take that. I'm getting a lot of questions from my patients about, you know, whether they're at risk and what risk is acceptable. So the answer I'm giving all of them is that the government has published a list of high-risk patients. So these are category 1 patients. If you put into Google category 1 coronavirus list, you'll come up with a group of patients who are high risk. These patients have been advised to be shielding, and they will all get a letter and a text message to advise them of this. If you're not in this group, then the advice I'm giving to them is you need to discuss with your employer about your best way to social distance. So if you can work from home, then that would be the most ideal scenario to reduce your risk of infection. Some people are unable to do that, and the best thing to do is to speak to your employer on how you can reduce that risk as much as possible. So lots of different professions have different capabilities, and as much as you can, if you can stay at home, you will reduce your risk as much as you can. But the answer is that if you're not on that list, you should speak to your employer.
Okay, great. We have another question, which is about diet. It's saying, are there any special types of food you would recommend to boost immune system to help fight the virus?
So I think I can answer that, and we can sort of reiterate a healthy, well-balanced diet is going to allow you to sort of maintain the nutrients and bits that allow your body to naturally fight off the infection. Obviously, the importance of that, along with your hand hygiene, is going to help reduce your risk of the infection.
Okay, great. We've got another question from somebody who says they're a patient, and if you have a neurological problem, do you need to isolate for 12 weeks?
So again, for that, we would say it depends on your neurological condition. If you are at the high risk, the vulnerable patient group, if that's on the government website, that would indicate you're at high risk. If not, and if you feel that you're still sort of at a high risk and may need isolation, speak to your employer or speak to your GP. But again, it's difficult to comment individually.
No, that's great advice. I think obviously what we can't do is sort of offer sort of individual medical advice on this forum. It's more generic information. So I think your point is completely valid. If somebody has specific medical needs, they should discuss it with their sort of doctor and GP. So thank you. Pani, do you want to do a few more, and then I'll come back with a few more from the website.
Yes, thank you. The next one was in terms of masks, Dr. Jamie, you covered that they should just be disposed of. Somebody's asking whether they should be washed. What is the sort of?
I think it really depends. It's really difficult to answer because it depends on the type of mask that you're using as well, because some are disposable. I think if you've got a disposable mask, you shouldn't be reusing it. I think it's probably the biggest point that I can say. And I think before you wear a mask, really think, do you need it? And what does the World Health Organization say? If you have got a reusable mask, then I'd suggest just cleaning it with a Dettol wipe, giving it a proper clean and letting it air out. But again, I would really think about whether you actually need to use a mask and follow the guidelines that are currently on the World Health Organization in regards to that.
Great, thank you. The next one was a bit of a concern from somebody saying that there seems to be a lot of an outbreak in the northwest area, and they're just wondering whether that's due to genetics or other conditions or issues like that.
Do you mean Northwest London?
They haven't said, but I'm assuming Northwest London.
Yeah, I had a similar question on the website. They're asking because there's a news article saying it's more prevalent in the sort of Asian and sort of ethnic minority communities, and whether it's a genetic reason for it or not.
So the answer is, at the moment, it's not known if it's a genetic thing. We don't think there is any specific differences in the genetics, but we have seen that definitely there's a cluster in London. But thinking at the moment is that because the movement in London is always higher than the rest of the country, and that's why there is more cases in London. And the reason Northwest London is big is because Northwick Park Hospital is a big centre covering quite a large population area, and it probably reflects the amount of virus that was in the community in the first place. In terms of genetic link, there hasn't been anything proven just yet, but it's a possibility. It doesn't change the advice. It doesn't change anything you would do differently if you are of an ethnic minority. The advice is still the same for everyone.
And there's also evidence that if you have other health conditions, sort of like diabetes and hypertension or heart disease, that puts you at a higher risk category. And we as ethnic, sort of as Asian community, we do have that more than sort of the general population. That's just. how it is.
All right, thank you. Ashish, do you want to take a few on the website?
Yeah, I think I've got another question where somebody's asking, should they take chloroquine? But I think, Jamie, you've already covered it and said absolutely not. So
I think that's a big no. I think that's a massive no. Do not take any kind of medication that has not been advised or licensed by the UK government as of now. So anything you hear on WhatsApp, on Facebook, etc., do not try. All these drugs, they have a lot of side effects and they have a lot of risks associated with them. Hydroxychloroquine, if you overdose on it, you can die. And that has happened. So really important. Don't take anything. And if you are considering, contact a healthcare professional, but please, please, please check the NHS website, check the government website, and do not forward any information unless you are 100% sure you fact checked it.
Could I just jump in? Because there was a question about when or how long it will take to create a vaccine for coronavirus. I'm just wondering if one of you may be able to.
So I think the difficulty with creating a vaccine is where, we need to find the right sort of target for the vaccine and then create it, go through through the trials, into human trials, and then sort of mass produce it. There's lots of steps and lots of stages along it. There's been a global effort, multi-center throughout the world, America, the UK, particularly Oxford, there's Singapore, everywhere they're trying to work towards developing a vaccine, but we're not anywhere near. And once sort of it's still a long way away. They've said so far sort of 18 months, 12 to 18 months. So they're still sort of a long way away. It took, for example, for Ebola to create a vaccine, it took 5 years. So we're talking about a longer time frame than we are sort of used to with what's happening now.
Thank you.
I've just got, I'm just going to bring in Jasmine Shah from the NPA. I think she's just going to cover a few points on the medical side, on the medicine. So just bear with me for a second. Jasmine, can you hear us?
Yeah, I can hear you. Can you hear me?
Yeah, we can hear you. You're on. If you want to put your video on and just...
Let me try that. Hang on. Hi.
Hi. Okay, you're on. So please, I think you was mentioning about the medicine side.
That's right. Hi. Can everybody hear me?
Yeah, go on.
Hi. Yeah, so I just wanted to mention as a pharmacist that it's really important that people carry on taking their usual medicines during the COVID outbreak, but taking regular doses and they maintain that. Now, there has been some talk in the news and media about taking certain types of blood pressure medicines might make the infection worse, but there is no clinical evidence at this point. So the important message is people should not stop taking their regular medication. And as Jamie has already covered, they must also not start taking new medicine like chloroquine, even if they have it lying around the house from their last trip abroad, for example, when they might have taken it for malaria prophylaxis. They must not start taking it just because they think that it may help, it may prevent them from catching the coronavirus infection. So take your regular medication, take it on time as always. When you're ordering your repeat prescriptions, please don't order up too much and stockpile it. People should only order the usual amount. And I think doctors are also prescribing the usual amount. That's the current advice, to make sure that there's enough medication so everybody has the treatment that they need as we go through this crisis. So that's really, really important. So I just wanted to reiterate that point. And secondly, on the fact about keeping healthy during this crisis, wherever possible, and ideally, people who may currently be smoking should try and give up smoking, because obviously smoking is injurious to health in the long run anyway, but especially given that this coronavirus is a respiratory condition and affects the respiratory system quite badly, it would be a good idea to try and give up smoking at this point. So I think that's the key message at the moment. Also, to add to that, is when you need to go and visit a pharmacy to collect your essential medicines, etc., Do not enter the pharmacy if you already are running a fever or you have a new continuous cough or like exhibiting symptoms of coronavirus. Please do not go into the pharmacy if that's the case. If you need to, you can ring up your local pharmacy and be able to speak with your pharmacist, and they'll be advise you on what how they can help you. One more point, a lot of patients are requesting home deliveries of medicines at the moment, and a number of pharmacies obviously offer a home medicine delivery service regularly anyway. But pharmacies are currently coping with a very, very large number of delivery requests. So the advice to them is they will be prioritizing deliveries to patients who are in the shielded group, which doctors Jamie, Deep, and Sachin have already talked about, which are the highest risk patients who must not leave their houses under any circumstances where possible. So the deliveries of medicines will be prioritized for those people. If you're not in that shielded category, please try not to request the medicines delivery to help support pharmacies so they can actually make the deliveries to the patients who do need it. And also, excuse me, it's very important as well that you discuss fully your medicine delivery requirements wherever possible. If you're not in a shielded group of patients, but you need medicines to be collected from the pharmacy, try and see if you can ask a friend, relative, or a neighbor to collect it on your behalf and leave it at your doorstep, please. And that would really help pharmacies at this time, because you may have heard pharmacies are working very hard, just as doctors are and the frontline NHS teams are. But they're also going through difficult circumstances themselves, where a number of their own teams may also be off in isolation or have fallen ill themselves, just as we have the same situation in GP practices, NHS, and frontline staff. So thank you for supporting all healthcare workers in that manner.
All right, thank you so much, Jasmine, for coming on board. I'm gonna just cover one more question that is from the website. It's basically somebody saying they have a cough and they've been breathless and have had corona-like syndromes for 3 weeks now. Do they need to go straight to the hospital, or should they stay in self-isolation?
Yeah, so I can take that. So it depends on how breathless they're feeling. If they're feeling very breathless, then this is someone that who I would advise to go to A&E if they're feeling very breathless. We have seen in some people that the symptoms have persisted for a few weeks. If they're not very breathless, then I suggest they phone 111 now. Depending on the area they are in, they will get an assessment, and then they will be able to speak to a GP or another healthcare professional to make sure they're assessed. But the answer is, if you're very breathless, then I would recommend for this patient to go to A&E. If they're not so breathless, then I would recommend phoning 111 now, and they will be able to get an assessment by a clinician, and they can then be assessed face-to-face if they need to have an assessment.
Okay, thank you. Pawnee, do you want to take a few more questions?
Yeah, just a couple around sort of how likely is it that who is going to get this, or is it likely that the majority of the population are likely to contract this virus? And when do we think the peak is going to be, and sort of the restrictions relaxed?
So I think because this is a new virus, we've never faced this ever as a global population, there is a chance that most people will get infected. The idea of hand washing, the idea of social distancing and sort of social shielding is to try and reduce this peak. The peak had been predicted for this weekend. It's been now sort of pushed backwards because these measures have been put in place and hopefully are working. But we can't predict this because we've never faced a crisis like this in the past. And it's a difficult one. I think everyone's working hard to it. It's difficult for us individually to give you this information. And I would say, see what the government says, and they have sort of daily briefings about this, if that does help. However, watching the news every day, sort of morning, evening, afternoon, is not going to help you, not going to help your mental health. So take it in small doses as well. and sort of worry about sort of other things that you can sort of control and sort of do. Because a lot of this, you've got the right people trying to do the things to try help you, and just sort of work to better help yourself as well.
Yeah, I think I definitely agree with that. I think the only thing as well, just to add on to, again, the government's aim is to slow down as much as possible that progression. And if the peak is being extended, that's actually a good thing, because what we don't want is everyone getting symptoms, everyone turning up at A&E all at once, and we as hospitals, pharmacies can't cope with that demand. We want to try and keep that number as minimal as possible, so that the services can continue to cope with the current influx of patients. So I think, as Dr. Sachin said, it's really important that we take all the measures that we can. So hand hygiene, don't go out unless it literally is essential, and really spreading that message amongst our family and friends.
Great, thank you. Do we have time for any more?
Yeah, I think we've got quite a few other questions. So I know we've gone over 3 o'clock, but doctors, if you're okay to go on for a bit, I think we'll do a few more questions, and then we'll do a summary in English and Gujarati. So yeah, apparently let's do a few more.
Okay, fine. I've got one. So what is the risk if I am on losartan, or I'm probably not pronouncing it right, losartan or ramipril? Is there a link with the ACE enzymes in my body? Apparently some hospitals are testing levels for this.
So a lot of people have asked this question. At the moment, the advice is do not change your medication. There is no evidence at the moment that you're at increased risk. What the advice is, carry on taking your medications as normal. And if there's any concern that you have, speak to your GP. I'm getting lots of queries like this, and my advice for most patients, in fact, all patients I've spoken to at the moment, is not to change the medications at the moment, because there's no definite evidence that you're at increased risk. The risk of actually changing your medications might be higher. It might predispose you to strokes and heart attacks if you've got uncontrolled blood pressures, and actually that's in some cases more risky. So if you're unsure, speak to your doctor. But at the moment, the advice for most people actually is not to change and come off the medications.
Great, thank you. We've already covered caring for people in the home. So, well, that was the next question. That's all from the Q&A.
We've got a few from the website. One of them is concerning people who have pets. So it's asking, is it possible to catch coronavirus from our pets?
So at the moment, no evidence that there's transmission from human beings to other pets. We don't know enough about the virus, but the guidance at the moment is that there's no evidence at the moment that it goes from humans to pets and back to humans. But watch this space, it's a possibility. It doesn't change any advice we've given today.
Ashish, you're on mute.
Sorry. Thank you. We're getting quite a lot of questions, very similar, all asking where people are living in multi-generational families, how can you self-isolate within the house? If there are any practical tips or guidance you can offer, that would be appreciated.
So I think it's, I'm happy to say that one. I think it's really important that you're aware that you've got different generations of people, that you've got children, kind of working adults, and you've got elderly, and just to continue to meet those daily needs. So, you know, elderly people need their daily routines, caring for them, same with children. And I think it's a case of really following 3 main things. So first thing is government advice. So really making sure you're following that advice with good hand hygiene, only going out if it is actually essential. Second thing I would say is having a really good diet and exercising every day, even if it's just 20 to 30 minutes, just enough to make you sweat, and just finding things that are adaptable as well. So kind of doing exercises with children. So I think there's lots of things out there for children. I think there's people on YouTube. There's lots of websites for elderly people as well. There are lots of resources for that. In terms of, and then the final thing as well is just really being aware of if your children, you or elderly relatives do have any other conditions, just to follow the information on the government website. And if you are worried, do use NHS 111. Use the website. If the website will direct you to if you need to call, if you need to contact your GP, or if you need to go to emergency services. And I think, like Dr. Sachin said earlier, don't be scared to use the services. Our services are there to be used, but they're there to be used appropriately. And I think that would be my advice. And as much as possible is try and make sure that everyone in the household has a structure as well. And if your elderly relatives are at risk, do try and minimize contact where possible, and make sure that elderly relatives and children understand what's going on. I think from my experience working in the hospitals, I think it's very scary if you don't understand what's going on. So just take the time out to explain it to your relatives.
I would just add to that if you've got an elderly relatives, then the best way to reduce your risk is to make sure that you don't leave the house unless it's absolutely necessary, and that will reduce your risk of picking up an infection outside and bring it indoors. And so practically, that's probably the most important thing you can do. And the only other thing is, if you do, as someone in the household, develop symptoms, then it's difficult, but isolating them away from everybody else is probably another useful technique. So the guidance of the government website is, if you're someone who's got symptoms of coronavirus, then you should, if you can, use your own toilet in the house. Practically reduces the risk of infection going to anybody else, and keep yourself away in a separate room if possible. Again, don't share the room again, and that will reduce the risk of transmitting to anybody who's elderly at home and catching the virus.
Yeah, and I think there is another similar question on the website. Their husband was shielding, but obviously they needed to go out for shopping. So how best to protect them from bringing the virus into the home? And I think what you just said in terms of if they can use a separate sort of room or bathroom as best possible would be the kind of approach to take, and take all the basic precautions about washing your hands frequently, etc. So thank you for that. We had one more question as well. And I think a lot of people, again, have asked a similar question. How long will it take to develop a vaccine for COVID-19? I'm sure that's probably $1 million question, but any sort of thoughts the panel has on it?
So I think Dr. Sachin's answered that already, and he answered it quite well. I don't have much to add onto what he really answered. And I think the main points are, A, it's going to take time. There are lots and lots of centres around the world all rapidly trying to come up with a vaccine, working hard. And it's important to remember that vaccines take time to develop. Vaccines need to be trialed. Vaccines need to be trialed for lots of reasons, to make sure they're actually working, to make sure they work in humans, and to make sure that they work without side effects. So I think until we've met those kind of criteria, it's very difficult to say how long it will take to produce a vaccine and how long it will take to mass produce it to the general public.
Okay, great. I think we have tried to cover, and I know there are quite a few questions left. I think what we should do now is, if we can do a little summary, maybe the panel can do it in English, and Jasmine, if you're there, you can do it in Gujarati, and then we can conclude today's webinar. And again, many apologies, because I know there are quite a few other questions still left. We will try and point as a follow-up with some information and links to the sort of main sort of government websites for information about from Public Health England, as well as NHS, as well as the government websites. But if maybe want to do a summary, can I ask Deep if you want to do a summary in English, and then Jasmine, if you can do one in Gujarati, that would be great.
Fine. Yes. So I think what we've covered really is the symptoms of coronavirus. So I'll go through them again. So cough, a fever, breathlessness are the big ones. And other people might have non-specific ones like a runny nose, a sore throat, feeling generally run down. If you get any of these symptoms, you need to isolate yourself for 1 week at least. And anyone who's been in contact with you needs to isolate yourself for 2 weeks. If you're unwell with the symptoms, then depending on how unwell you are, you will need to contact someone. So 111 or a GP. If you're not too bad, if you're feeling very unwell and very breathless, then you might need to go to A&E. So that's the first thing I'll say. The second thing, the most important thing, is to stay at home as much as possible. Only leave for essential reasons. Keep yourself well at home, and we've covered on how to lots of information on how to do that. I will just add there's quite a useful website on the NHS which gives us quite a lot of information on how you should be at home to make sure your mental well-being and your physical well-being is looked after. So we can put that up later. There's lots of community services out there, including your GP, 111, and then your A&E if you need it. Use them if you need to, but bear in mind that they will be under pressure and you might have to wait longer than normal. We covered misinformation and WhatsApp groups and Facebook groups. Really important to make sure you are checking and you're happy the information that you are giving to other people is correct, because you don't want to harm anybody else. And that's the way I think about it. If you forward that information to somebody else and they get harmed by it, then that's might be something that you could have avoided. So please be aware of that. And finally, good hand washing will reduce the risk. And we've gone through all the other conditions and the category 1 shielding conditions who should be shielded and not go out for 12 weeks fully. So yeah, anything to add from you guys?
I think it's covered, and I think just to reiterate, I think we've really gone through the point of making sure if you're going to share something, you fact checked it, but also please just all follow the same hymn sheet. So follow the NHS guidelines, follow the government guidelines, and just to be aware, there are so many resources out there for you guys. So things for children, things for elderly relatives, things for mental health, things for diets, things for exercises. There's so much information out there. Do use it and really look after yourselves while you're at home, and actually try and use it as a time to utilize family time, bond as a family, try and get as much positivity from the situation as you can.
The only thing I'd like to add, I just wanted to mention one thing. Lots of hospitals are now reducing or eliminating visitors. So just be aware of that. If you've got a family member who is in hospital, there's a good chance that you won't be able to visit that family member. So just be aware of that. So if you've got family members going in, make sure they're prepared for that themselves, and also you are. I know Northwood Park Hospital have banned all visitors because of the risk of infection within the hospital and to the staff as well. So that's just as an aside, please be aware of that. And if someone's going to hospital, then speak to the healthcare professional, take them in, and make sure that the patient's also prepared for that as well.
Okay, thank you. Jasmine, do you want to do a quick summary? Unmute. Yeah.
Hi, can you hear me?
Yep, you're on.
Yeah, તો હું ગુજરાતીમાં બોલવાની ટ્રાય કરું છું. આપણા કોલિગ્સે જે વાત કરી હતી, તો સૌથી પહેલા વાત કરી હતી કે કોરોના વાયરસના સિમ્પટમ્સ કે એને ચિંતન શું છે કે તમને કોરોના વાયરસ થયું હોય, તો સૌથી પહેલા જોવાનું કે તમને તાવ આવેલો છે કે નહીં, ઉધરસ થઈ છે કે નહીં, અને નવી ઉધરસ હોવી જોઈએ. તમને પહેલેથી જો ઉધરસનો કાંઈ પ્રોબ્લેમ હોય તો તે નહીં, સમથિંગ ન્યૂ, કાંઈ નવું હોવું જોઈએ. તમને શ્વાસ લેવામાં જો તકલીફ પડતી હોય અને વધારે તકલીફ વધતી જાય તો તે પણ કદાચ કોરોના વાયરસના ચિંતન હોય. તમને રની નોઝ એટલે નાકમાંથી પાણી નીકળવાનું શરૂ થાય, ગળું બગડે કે દુખાવો થાય, કે તમને એમ લાગે કે મજા નથી આવતી બોલવામાં, અને એકદમ થાક લાગી જતો હોય, તે બધા
I think Jasmine, you've frozen. Might be the internet.
Sorry, hello? Can you hear me? Sorry, I lost connection for a minute. Yeah. તો
Go on.
I was saying કે જો કોરોના વાયરસના ચિંતન થયા હોય તો અત્યારની એડવાઇસ એમ છે કે તમારે 7 દિવસ સુધી ઘરે એકાંતમાં રહેવાનું અને તમારા ફેમિલી મેમ્બર્સ હોય ઘરના હોય જો એ લોકોને જો તમારા કોન્ટેક્ટમાં આવેલા હોય તો એ લોકોને 2 અઠવાડિયા સુધી ઘરમાં એકાંતમાં રહેવાનું એટલે આઇસોલેશન. દેટ મીન્સ કે તમારે ઘરની બહાર નહીં જવાનું અને બીજા સાથે કોન્ટેક્ટ નહીં કરવાનો. જો તમને વધારે બીમારી લાગે તો તમારે ડિપેન્ડિંગ તમને કેટલી વધારે પડતી બીમારી થઈ છે એ પ્રમાણે તમે તમારા ડોક્ટરને ફોન કરી શકો છો એ લોકોને પૂછવા માટે કે તમારા કઈ જાતની બીમારી છે અથવા તમે NHS નો નંબર છે જે 111 તે ફોન કરીને પણ તમને એ લોકો અસેસ એટલે તમને ચેક કરી શકે. જો બહુ બીમારી થઈ હોય ખાસ કરીને જો તમારે શ્વાસમાં એકદમ તકલીફ થતી હોય તો તમે 999 જે ઇમરજન્સી નંબર છે તેને ફોન કરી શકો અથવા એક્સિડન્ટ એન્ડ ઇમરજન્સી ડિપાર્ટમેન્ટ છે તમારા લોકલ હોસ્પિટલનો જે A&E ડિપાર્ટમેન્ટ કહે ત્યાં પણ તમે જઈ શકો છો. જો તમને વધારે બીમારી હોય એમ લાગે કે તમને બીજી જાતની બીમારી થઈ છે કોરોના વાયરસ સિવાયની કે હાર્ટ એટેક જેવું લાગતું હોય કે સ્ટ્રોક આવેલો હોય કે બીજી ગમે તેમ સિરિયસ એકદમ બીમારી હોય તો તમારે અત્યારે વ્યાધિ કર્યા વગર પણ A&Eમાં જઈ શકો છો કારણ કે તે બીમારીને ઈલાજ કરવો પણ જરૂરી છે અત્યારે. અધરવાઇઝ જો તમને બીજું કાંઈ પણ સારું હોય બીમાર ના હોય તો પણ અત્યારની ગવર્મેન્ટની અત્યારે સૂચના છે કે બધાએ ઘરે રહેવાનું. ખાલી જરૂરિયાત પડતી વસ્તુ માટે જો બહાર જવું પડે કે તમારે દવા લેવા જવું પડે અથવા કાંઈ વસ્તુ ખાવા પીવાની લેવી જવું પડે તો જ ઘરની બહાર જવાનું. તમે ઘરે હો ત્યારે સરખી રીતના હેલ્ધીલી એટલે સારી જાતનું ભોજન કરવાનું, એક્સરસાઇઝ કરવાની, દરરોજની કસરત થોડી કરવાની અને બીજા ફેમિલી મેમ્બર સાથે કે તમારા રિલેટિવ સાથે ફોન પર વાત કરવાની એટલે શું તમને એમ સાવ એકાંત વધારે તકલીફ ના કરે તમને. બીજું એક વાત છે કે અમે ઘણા લોકો વોટ્સએપ ઉપર આપણા ઘણા ફેમિલી મેમ્બર સાથે ગ્રુપમાં જોઈન થયેલા હોઈએ છીએ આપણે. એમાં ઘણી જાતની અત્યારે જે વિગત આવે છે તે ખોટી હોય છે અને એ અફવા ફેલાવવાની જરૂર નથી. એટલે તમને જો એવું ખોટી વિગત આવી હોય તો તમે પ્લીઝ બીજા કોઈને આગળ એ તમને મોકલો તમે સંદેશો એ પહેલા ચેક કરો કે આ સાચી વાત છે કે ખોટી વાત છે. કારણ કે અફવા ફેલાવવાથી ખોટી વાત ફેલાવવાથી બીજાને છે ને હાનિકારક થઈ શકે એમ છે. તમે નોર્મલ દવા લેતા જાઓ, કાંઈ પણ તકલીફ પડતી હોય કે તમે બીમાર હો તો આપણે વાત કરેલી છે પહેલા 111 નંબર અથવા ડોક્ટરને અથવા A&E સુધી તમને જરૂર થઈ. સૌથી વધારે ખાસની વાત છે જે સમજવાની કે રેગ્યુલરલી હાથ ધોવાના પ્લીઝ. હાથ ધોવાથી તમારી ઇન્ફેક્શનની જે રિસ્ક છે કે ડેન્જર છે તે ઓછું થાય એમ છે. અને થોડાક વખતમાં પણ વેબસાઇટ ઉપર થોડીક બીજી માહિતી મળશે તમને. એટલે થેન્ક યુ.
Thank you so much. And just to reiterate, we'll send it out on the email following it. There is a whole information in Gujarati available on the show. We'll send the links out for it after this webinar. So thank you. And we are a little bit overrun. So can I ask Nilesh Bhai to give us a few concluding words before we close for today?
It's been one of the difficult topics, which is very, very unknown by all of us here. And I'd like to thank Dr. Sachin Shah, Dr. Deep Shah, Dr. Jamie Shah, and also the input by Jasmine for various things. It was very, very informative. A lot of precautions which has been suggested, a lot of advice, where to go, what to do if anybody is caught with these things. So thank you all of you for giving us a great input for all of us. And at the same time, I'd like to thank Ashish Bhai and Bhavni Bhai, Ben, to give us all the information
Definitely.
at the same time. So thank you very much. And once again, hope you'll continue listening to all the future webinars which are forthcoming as well, as I mentioned before. So thank you.
Thank you, Nilesh Bhai. And also, thank you so much to Dr. Jamie Shah, Dr. Sachin Shah, and Dr. Deepsha. Thank you so much for all your work. I know behind the scenes you guys have done a lot. And also Jasmine Shah jumping in, given all your busy schedules at the moment with pharmacy and hospitals, etc. So thank you so much for joining. Apologies, I know we haven't managed to cover all the questions which we have received. We will send out as much information and links in the follow-up email goes out to everybody registered. And also, obviously, keep an eye out on the OSHA website, but more importantly, on the government websites, the Public Health England websites and NHS websites for all news and information about coronavirus and key guidance as well. So once again, thank you everybody for joining us today on the webinar. We had something like 448 people in total who watched it live. So clearly, obviously, there's a lot of questions and a lot of people that were interested in it. But thank you so much to everybody from the panel for taking time out from their busy schedules for today. And stay safe, everyone. Take care.
Stay safe. Thank you very much.